Good evening. This is All India Radio, Kohima. I'm Jonas Yandan with Evening News. And the headlines. COVID-19 vaccination to open for everyone above 45 years from tomorrow. Health Ministry reviews COVID-19 vaccination drive and preparations with states and union territories. Nagaland reports 107 fresh COVID-19 positive. Active cases jumps to 113. And St. Paul Training Institute Pesama under Kohima district declared as containment zone. As the number of COVID cases are on the rise again, we appeal to our listeners not to lower the guard, follow all the precautions, and all those above 45 years to get vaccinated without any hesitation. Stay safe and protected by following these 3 simple steps. Wear a face mask, focus on hand and face hygiene, and maintain a distance of 2 yards for social distancing. Now the news in detail. COVID-19 vaccination will be open for everyone aged above 45 years from tomorrow, irrespective of comorbidity. People born before 1st January 1977 are eligible for this phase of vaccination. The comorbidities clause has been removed to make the system simpler. The GoWin system is open for registration and for booking of appointment of all persons of 45 years and above. On-site registration of such persons will also be permissible. If a beneficiary has taken an online appointment for vaccination on GoWin, then there is no need to take any further appointment at private or public hospitals. If any hospital does not follow these guidelines of vaccination, one must lodge a complaint at toll-free number 1075. Union Health Secretary Rajesh Bhushan today reviewed the COVID-19 vaccination drive and preparations with all states and union territories. From tomorrow, the COVID-19 vaccination is open for everyone aged above 45 years, irrespective of comorbidity. The meeting focused on the identification of low vaccine coverage pockets, particularly in districts showing COVID surge, and for taking corrective actions there. With regard to the vaccination coverage of healthcare workers and frontline workers, the states have been advised to ensure that only eligible beneficiaries are registered and vaccinated under these categories. Besides, the states were also asked to conduct regular reviews of vaccinations at private COVID vaccination centers with respect to their capacity utilization. They were advised to ensure that there is no sedimentation of vaccine stocks at any level of storage. During the review meeting, the centre also asked the states and UTs to maintain vaccine wastage at less than 1%. The states have also been directed to ensure timely utilization of available stocks to avoid expiry of vaccines. Nagaland reported a single highest day COVID-19 positive cases today after nearly a gap of more than a month when the state have been reporting single-digit cases or no cases. Health and Family Welfare Minister S. Pangyapom in a tweet said 107 cases of COVID-19 have been reported from Kohima. Health Department COVID-19 bulletin stated that the cases were detected among traced contacts. The total positive cases jumped to 12,340. With no recoveries reported, the recovered cases remained at 11,980. Presently, the number of active cases has drastically increased from 8 to 113. St. Paul Training Institute Pesama under Kohima district has been declared as containment zone in view of the detection of COVID-19 positive cases. Deputy Commissioner Kohima, Gregory Tejavele, in an order said there will be strict no entry or exit from the containment zone. He said the other order was necessitated to map the local transmission of the disease and prevent the contagion from spreading. The Deputy Commissioner said the residents within the containment zone will be regularly monitored by the medical team over phone or otherwise till they recover, test negative for COVID-19 infection, and henceforth be fully governed by various SOPs and discharge policy of the government. Informing that the containment zone was mapped and cordoned off, Tejavele advised the public to follow all safety precautions such as wearing masks at all times, frequently washing hands and maintaining physical distances to ensure public and personal safety within the proximity of the containment zone. The Deputy Commissioner further cautioned that anyone failing to comply with the guidelines will be penalized under Section 51 to 60 of the Disaster Management Act 2005, the Epidemic Disease Act 1897, and relevant sections of the Indian Penal Code. This news comes to you from All India Radio, Kohima. You can also listen to this news bulletin on our YouTube channel, AIR News Kohima. A group of Nagaland BJP legislators, led by Deputy Chief Minister Y. Button, yesterday met with Assam's Minister and NEDA convener Himanta Biswa Sarma at Guwahati. Media cell of Deputy Chief Minister stated that the delegation had a meaningful discussion on various issues pertaining to both the states and shared visions of BJP for the progress and development of the Northeast India under Plethora visionary program initiated by Prime Minister Narendra Modi, including India's Act East policy. Extending best wishes to Chief Minister Sarbananda Sonowal and the party in the ongoing assembly elections, the team expressed hope that BJP in Assam will come back stronger with a landslide victory. NEDA convener also thanked the delegation for their visit and said that the Goodwill Mission will be seen as a good sign of unity and strength within the party in the region. Deputy Chief Minister was accompanied by Minister Kashio Sangdam, advisors Dr. Longriniken, Kajeto Kinimi and H. Haing. Minister for Higher Education and Tribal Affairs Temjen Imna Along said that Catholic institutions have 100% education policy for the upcoming youths in the state. He said many students who have passed out from Catholic institutions are leaders in many areas and praiseworthy services are rendered by them. The minister was addressing the closing ceremony of St. Xavier College, Jaluki Annual Sports and Games Day today at Zeveride Stadium in Jaluki. The minister encouraged the people to be strong and brave while calling upon the students to do their best and work hard. He expressed hope that determined and hard-working students will come out of St. Xavier College to rebuild the foundation of the society and become a good and responsible citizens. Lamenting on the 22nd March Lamhai Namdi village gruesome incident, Along said it is unacceptable and urged the gathering to condemn such kind of heinous act. The Naga headgear, which carries the unique identity of the Nagas, reaching every nook and corner of the globe, is on the verge of disappearing, as there are only few individuals left who are into this art. However, to make this masterpiece, the tribesmen not only face problem in making the headgears, but also face problem due to dwindling of resources. It is time-consuming and difficult to make natural dye, for which the craftsmen now depend on synthetic dye. Naga headgear, which is woven using more than 12 materials collected from the wild, is not just a hat, but it has a rank as well as a status. Few decades ago, one headgear cost around 1,000 to 5,000, but now it is costing nearly 12,000 to 20,000 rupees. A recipient of National Award in making Naga headgear in 1986, Bukhayo Kemungan, 63 years old, who still impressed onto this art by opening a handicraft store in Trensang Town, said, even with the current rate of cost, it is difficult to manage as materials are not available. Bukhayo, who received a one-time pension salary of 21,000 rupees from the government, has opened his craft store to teach any youngster who is interested in it, so that this unique art of craft is not lost with time. And now to end the news, here are the main points again. COVID-19 vaccination to open for everyone above 45 years from tomorrow. Health Ministry reviews COVID-19 vaccination drive and preparations with states and union territories. Nagaland reports 107 fresh COVID-19 positive. Active cases jumps to 113. And St. Paul Training Institute Pesama under Kohima district declared as containment zone. That is all we have in this evening news bulletin. Good night.